Hi team, thanks for coming in for this meeting today where I'm going to be presenting the collaborative therapy. It was created in the 1980s by Harlene Anderson and Harry Golashan. It's also known as the Collaborative Language System Therapy, or CLS. It has a humanetics approach, which is interpreting the language. This was originally created as a philosophy where language creates meaning, problems are sustained and solved through language. It doesn't have an opinion on medication and uses everyday language versus jargon. The therapist is going to be a client-focused, non-hierarchical, using active listening, a not knowing stance, which will be discussed later. Your role is going to be a learner researcher asking relevant questions. The client is going to be deconstructing their stories to find new possibilities, using conversation to create change, talking majority of the time in session, and their role is going to be a teacher for you. The client and therapist relationships is seen as being collaborators, and the therapeutic relationship and the therapeutic space are safe spaces for everyone to be open, including yourself as a therapist. Good quote going forward is going to be that this model is really focused on acceptance, curiosity, and empathy. The collaborative model and recovery model do intersect with this. CLS and recovery both see healing as a journey without a set number of sessions. The client creates the goals and drives the change they want to see. That change starts when the client creates the appointment, attending therapy to discuss problems. The therapist not knowing or being curious approach fosters collaboration with the client. Client discovers new possibilities and meaning through conversations with the therapist, and the cycle continues until the problem is solved and therapy is ended. This approach has really focuses on client strength and resiliency. The therapist's role is to guide the client to present the solutions for themselves. So that builds the strength, believing that people will build on their own strengths to recover, and asking clients about areas of their life where they are already successful. The resilience of the clients will be further fostered by leading the agenda for each unique session. The client creates the goals for themselves using the tools that they have to create a new positive narrative and identity through the conversations in therapy, and highlighting ways the client has already created change in their life. This helps us guide change because we're meeting people where they are. We're not using jargon language, and our not knowing stance is basically being curious about the clients in the therapeutic space to learn about their intersectional and contextual experiences. We're empowering the client by listening with curiosity and compassion as a learner and researcher to give them the power over the progress that they make in therapy. And this is also a not heavy diagnostic approach. It's more of a holistic approach that uses language to guide and sustain change. Our client, what we focus on is going to be low-income individuals, couples, and families, people in the LGBTQ plus population, and teens removed from their family of origin. So with low-income households, we're going to want to focus on how does the intergenerational language impact the situation that we're currently in? Do they use responsibility with shame? Do we want to, and can we explore how that's impacting their relationship and conversations that they're having with their significant other or family? Or even with themselves. So we're also going to want to be really diligent about treating and seeing the client as the experts on their own life. We don't want to assign journals or homework because we don't know what they can do. Whereas if we ask them, what do you want to discuss today? What do you want to do until next session? It gives them the expert knowledge on what they can do in their life and building on the strengths and habits that they're already working on. Within the LGBTQ population, we want to be really sensitive with the marginalization pressures that they have and not mirroring the negative language that sometimes that they can bring into session where they view themselves as abnormal or sick. And we really want to work with them and modeling and helping them deconstruct that unhealthy story into something positive and healthy. Not knowing and being curious is also going to be really important. I know a lot of us have our own experiences with our sexual and gender identity and that journey, and we do not want to apply that onto our clients. Wherever they are right now is appropriate for them, and we just want to make sure that they're telling a healthy story about them and using tentative language. It sounds like what I'm hearing is this. Maybe you're experiencing this, so that they can confirm and correct. And especially with our vulnerable population of teens removed from the family of origin, we really want to work with them on deconstructing the trauma that they've gone through. If they bring up something traumatic in session, don't assume that that's where they want to spend the session going. Ask and confirm if they want to make that the agenda for this session. We really want to create a safe environment for them by creating space for them to play or do alternate activities that isn't just sitting in a chair in a room. That can be really intimidating for them. And we also want to create language that contextualizes their stressors. The emotions and behaviors that can sometimes be unhealthy for them and get them in trouble in school or in their living situations can be really related to the stressors that they're experiencing, and just contextualizing and helping them develop that language and turning it so that we can co-create a positive narrative and identity for them. So what we're going to be seeing is we're going to be shifting meaning and belief. So an example that we have is a mother and daughter who report conflict stemming from the discovery that the father and husband's infidelity. So a therapeutic approach that you could take into this is active listening, being public to share her observations and opinions using tentative language. I'm hearing this. And we also, in this situation, we would want to explore cultural differences and expectations for male roles as providers. Maybe the mother and daughter have different expectations on men's roles within the family. And we want to use role playing and really examining the language that they're using to discuss it so that they can come upon these discoveries themselves. Reconstructing interaction. So how do people interact with each other? And another example, we had a husband and a wife who were experiencing monetary challenges in their relationship. And what the therapist discovered is that how they discussed these issues with each other created additional conflict within the relationship. So the therapist made sure to hold space for each person to share their feelings, expectations, and define the language that they used. Once both people felt heard and space was held for them, they were able to understand that the husband really had this unique definition that was influenced by his parents on responsibility and how that impacted his attitude in these conversations. And shifting how people feel. This was, a unique client. We had a lawyer coming in who was seeking therapy at her family's request. She felt really pressured to prove herself at work, and she was working a really unsustainable. Well, they weren't understandable. She was doing a great job at work and she was working long hours, but it impacted her ability to have a well-rounded diet and social relationships. And the therapist really used a not knowing approach, asking a lot of questions. What does that mean for you? How does that look for you? And being public about their perspective as, being a professional themselves with lots of work hours, and how setting time aside for themselves really helped the quality of work. And by focusing in on language, we were able to determine that the client already knew that they, worked too much and they didn't have energy, that sometimes they didn't have energy to put into work that they wanted to do. And so really guiding the client to see that they already had the solution of creating a better work-life balance within themselves and just supporting that process. Here are my resources, and if you guys have any questions, I'm more than happy to ask any questions. I know that was really fast, but we're always really pressed on time. Thank you guys for everything.